Stop brushing your teeth the exact moment you wake up. You think you're cleaning your mouth, but if you do this right before sitting down to breakfast, you might actually be executing the single most destructive habit in your daily routine, literally scrubbing away your enamel and locking in a cycle of chronic sensitivity. I'm Dr. Smith Amsterdam. Today, we are dismantling the old myths and looking directly at the microscopic truth of what happens inside your mouth at 7 a.m. In this video, we aren't just skimming the surface. We are going deep into salivary biochemistry, the pH danger zone, and the hidden anatomy of your tongue. By the time we hit the halfway mark, I'm going to reveal a startling counter-argument that even some of my colleagues get wrong. And if you watch until the very end, I will hand you the precise 6-step clinical protocol that reverses morning enamel abrasion and delivers noticeably stronger teeth in just 14 days. If this is your first time, please hit the like button so YouTube recommends this video to others who needs it, and subscribe so you don't have to miss any of our videos. Now, let's proceed. To understand why brushing first thing can backfire, we have to look at what happens when the lights go out. While you are asleep, your mouth enters a state of near-total defense vulnerability. Your salivary glands undergo a dramatic shutdown, with flow rates plummeting by up to 85 to 90%. Why does this matter? Because healthy human saliva is a sophisticated biological fluid. It isn't just water. It's an active defense mechanism packed with calcium, phosphate, and heavy bicarbonate buffers designed to keep your oral pH at an optimal, safe range between 6.7 and 7.3. When that flow dries up overnight, your natural shield vanishes. The bacteria in your mouth, primarily strains like Streptococcus mutans, don't sleep. They feast on cellular debris and microscopic food remnants, generating metabolic waste products known as volatile sulfur compounds, or VSCS. This is the biological reality behind morning breath. But here is the critical kicker. Without saliva to constantly bathe and remineralize your teeth, your enamel spends 8 hours sitting in a stagnant, sticky biofilm, slowly softening as the oral environment turns increasingly acidic. You wake up with your teeth in their most vulnerable, fragile state of the entire day. Think about your current routine right now. Drop a comment below. Are you a team brush first or team brush after breakfast person? Be honest, because what I'm about to show you next might make you completely rethink your answer. The 7 clinical reasons to flip your routine. Reason 1. The mechanical ignition of the salivary engine. The absolute fastest way to wake up your body's natural defense mechanism isn't a toothbrush, it's mastication, or chewing. The moment you eat a tooth-healthy, structured breakfast, your periodontal ligament registers the pressure and signals your nervous system to ignite the parotid and submandibular glands. Suddenly, your mouth is flooded with fresh, highly buffered, alkaline saliva. This natural surge instantly goes to work, diluting acids, washing away loose overnight biofilm, and delivering fresh calcium right back into the microscopic pores of your enamel. When you brush before this happens, you miss out on this free, biologically engineered power wash. Reason 2. High-friction enamel abrasion. Think about a dry car windshield coated in fine sand. If you turn on the wipers without spraying fluid first, you're going to micro-scratch the glass. Brushing your teeth dry immediately upon waking presents the exact same mechanical hazard. With overnight saliva depleted, the friction coefficient between your toothbrush bristles and your unlubricated enamel skyrockets. Over months and years, this high-friction brushing on dry, unbuffered teeth leads to microabrasions, accelerated enamel thinning, and microscopic notch wear right at the gum line, exposing the highly sensitive inner dentin layer. Reason 3. The destruction of the fluoride shield. When you use a quality fluoride or hydroxyapatite toothpaste, it doesn't just clean. It leaves behind a critical, microscopic topical layer that bonds with your enamel to form fluorapatite, which is far more resistant to acid attacks. If you brush the second you wake up, and then 10 minutes later sit down to drink a warm cup of coffee and eat breakfast, you are literally washing that fresh protective shield right down your throat before it has a chance to chemically integrate into your tooth structure. You're paying for premium protection and immediately rinsing it away. Reason 4. Disrupting the bacterial acid spike. Overnight bacteria are primed and waiting for a fuel source. If you brush them away first, you remove the surface layers, but you leave behind the deep-seated bacteria hidden inside the microscopic pits of your teeth. When you eat first, the combination of food movement and the massive saliva surge disrupts this bacterial ecosystem mechanically and biochemically, stabilizing the oral microbiome before you ever introduce the toothbrush. This yields far better long-term bacterial control throughout the afternoon. Reason 5. The chaos of the 30-minute acid window. Let's look at a major point of confusion: the breakfast acid spike. Breakfast staples like orange juice, coffee, berries, or even yogurt are inherently acidic. When these touch your teeth, they temporarily demineralize and soften the outer microscopic layer of your enamel. If you brush immediately after an acidic breakfast, you are brushing your teeth at their softest, scrubbing the acid deeper into the tooth structure. But here is the secret. If you eat first, you can strategically time your brushing to happen after your saliva has already neutralized that breakfast acid, keeping your enamel perfectly safe. This next point involves an organ most people completely forget about when it comes to morning breath: the tongue. Let's look at why it holds the key. Reason 6. Deeper, long-term VSC neutralization. Brushing before breakfast provides a brief illusion of freshness, largely driven by the strong mint flavoring in your toothpaste. However, the root causes of bad breath, those volatile sulfur compounds, are still lingering deep in the oral tissues. By brushing after your meal, you clean away the combined debris of overnight stagnation and your actual breakfast, neutralizing odor-causing compounds at the root. This keeps your breath fresher for hours longer into the workday. Reason 7. The tongue's structural biofilm trap. Your tongue is not flat. It's a dense carpet of microscopic structures called filiform papillae. Overnight, this carpet traps a heavy layer of dead cells, bacteria, and mucus. When you eat breakfast first, the natural mechanical movement of food crossing the tongue acts almost like a gentle broom, loosening up that stubborn, sticky biofilm. When you finally go to brush and scrape your tongue after breakfast, you are able to remove significantly more bacterial mass than if you had scraped a dry tongue first thing in the morning. Now, let's be entirely fair and look at the whole picture. If you read the official public guidelines from organizations like the American Dental Association, they often lean toward brushing first thing in the morning. Why is that? Their logic is rooted in public health simplicity. They want you to remove the bulk of overnight plaque before you introduce fermentable carbohydrates, like a sugary pastry, pancakes with syrup, or a sweetened cereal. If your breakfast is loaded with pure sugar, those overnight bacteria will instantly turn it into acid. In that specific scenario, clearing the bacteria first makes sense. Furthermore, if you suffer from severe, clinically diagnosed dry mouth, or if your morning schedule means you must run out the door the absolute second you finish eating, brushing first might be your only practical option. The core takeaway here isn't about blind, rigid rules. It's about matching your routine to your specific oral biology. If you eat a modern, balanced breakfast, the protective power of saliva activation and the reduction of friction abrasion heavily favor brushing after you eat. Let's build your definitive morning routine. This is the exact 6-step protocol I designed for my private patients to eliminate sensitivity and maximize enamel density. Take a screenshot of this checklist. Step 1. The wake-up hydration flush. The second you get out of bed, drink 8 to 12 ounces of room temperature, plain water. Do not skip this. This mechanical rinse wakes up your salivary glands, dilutes overnight acid concentrations, and pre-hydrates your system. Step 2. Consuming a tooth-friendly breakfast. Prioritize nutrient-dense, structurally rich foods. Think eggs, avocados, unsweetened Greek yogurt, nuts, or complex whole grains. These foods demand active chewing, which maximizes your saliva's natural mineral delivery system while keeping sugar spikes low. Step 3. The 20-minute metabolic buffer. Once your meal is finished, wait 15 to 30 minutes. If your breakfast included acidic items like coffee or fruit, give your saliva this exact window to neutralize the oral pH and reharden the outer enamel matrix safely. Step 4. The precision mechanical clean. Use a soft bristled brush, ideally a high-quality sonic electric brush with a pressure sensor. Angle the bristles at a precise 45 degrees toward your gum line. Clean thoroughly for 2 full minutes using gentle micro-investment sweeps, not aggressive sawing motions. Step 5. Total anatomical clearing. Floss away any newly trapped breakfast debris between the contact points of your teeth, then use a dedicated metal or high-grade plastic tongue scraper from the back of the tongue to the front to clear out the loosened biofilm. Step 6. Protecting the mineral layer. Spit out the excess toothpaste foam, but do not aggressively rinse your mouth with water, and do not use an alcohol-based mouthwash immediately after. Let the residual layer of fluoride or hydroxyapatite sit on your tooth surfaces to protect your smile as you start your day. Here is my challenge to you. Try this exact eat first, brush second protocol for the next 14 days. Pay close attention to how your teeth feel when you drink cold water, and notice the freshness of your breath by mid-afternoon. The vast majority of my patients report a massive drop in structural tooth sensitivity within the first 2 weeks alone. Your oral health directly dictates your systemic health. Protecting your enamel is one of the smartest, long-term investments you can make for your body. If you found this deep dive valuable, hit that like button, subscribe to the channel, and download my completely free printable morning oral health guide linked in the description below. Drop a comment with any questions about your specific morning routine. I do my best to read and answer as many as possible. Before you go, here's an important note. This video is for general, educational, and informational purposes only. It is not intended to be a substitute for professional dental or medical advice, diagnosis, or treatment. Always seek the advice of your qualified dentist or healthcare provider with any questions you may have regarding a medical or dental condition. The information presented is based on general oral biology principles and does not create a doctor-patient relationship. Individual results may vary. Consult your dentist before making changes to your oral care routine, especially if you have existing dental conditions, sensitivity, dry mouth, or other health concerns. Thank you so much for watching all the way through, and I'll see you in the next video.